Hi, my name is Dr. Charles Feinstein, and today we're going to talk about the treatments of urinary incontinence. Basically, there are multiple treatments, and it all depends on the type of problem that you have. And if you have 5 people together who have urinary incontinence, they may need 5 different treatments. Not everybody needs the same treatment. If you have urinary incontinence where you lose urine when you cough and sneeze, when you laugh, when you do exercise, jumping up and down, that's called stress incontinence, and the treatment for that is usually surgical, where a 15-minute bladder suspension using a tape that goes underneath the bladder is performed on an outpatient basis. You go home an hour after the procedure is done, and that usually cures the problem. If the problem is called overactive bladder, where you have to run to the bathroom every 15 to 30 minutes, and sometimes you don't get there fast enough, and sometimes you leak before you get there, that's called overactive bladder. The treatment for overactive bladder is usually medications, pills of different types. There are also some creams that work. The problem with the pills is that after 2 months or 3 months, most people stop taking them. They're reliable, but they have to be taken for the rest of your life. We have a new treatment for overactive bladder that we use either in combination with pills or by itself, which is physical therapy. And by physical therapy, we're trying to strengthen all of the muscles of the female pelvic floor. So physical therapy, either with or without medications, works very well on the overactive bladder. There's a new treatment for overactive bladder which we're having outstanding success, which is Botox. Botox, as you know, has been used for many, many years for wrinkles and frowns and lines on the faces. But now we are taking the same Botox medicine and we're injecting it into the bladder, which is taking away bladder spasms. And it has cured many, many people who have been untreatable by all of the oral medicines that we've used up till now. So we have physical therapy, we have medications, we have Botox injections, we have surgery. Of course, there's behavioral training because some people are just drinking too much fluid, and we have to teach them to drink less fluid, especially after dinner, between dinner and bedtime. There's behavioral therapy, there's behavior modification. There's all these different various treatments that are available for urinary incontinence, and the best way to find out which treatment is perfect for you is to come to our website, drfeinstein.com, where you can see an evaluation form that will help you to evaluate your own urinary incontinence, and it will help you to figure out for yourself which is the best type of treatment for you and in your individual circumstance. Again, this is Dr. Feinstein. Thank you very much for listening to our little talk about urinary incontinence, and for more information, please go to my website, drfeinstein.com. Have a great day, and thank you so much for listening.